I think specifically coming from India, I knew that I did need a bit of a, not clinical, but I did need a bit of a public health perspective or a public health training in mental health. And I know that LSHTM, that's the work that LSHTM specializes in the best. And so it was a no-brainer to kind of see what I could learn from the institution and be trained from there. My current role I've now been in for about 4.5 years, and I actually got the job offer for it the day that I submitted my dissertation, which I was really happy about. A lot of the questions in my interview, I remember I was, kind of bringing up that I had done this course at LSHTM and reflected on my learnings from the course. And so I think it did definitely feed into how I ended up getting selected for the role, but it was kind of a straight shot because a lot of the work that we do at CMHLP is around developing and trying to scale up mental health and suicide prevention interventions in India. The first thing I did at my job after the course, I had to develop a protocol for a study. And so it's things like this that really, when you come back and try and do research here, they do apply very well. I do think it gave a very strong background in research and training in that. And I think if I reflect on the couple of years I had worked before my master's, I can very clearly see the change in me that I knew kind of how do I think about research in a way that's more contextualized and do it in a way that's more systematic. So I was kind of well prepared to come back and start working in India. I was able to, send out cold emails to people who I had been following for years and actually get to go meet them. I interned at a lab at King's that I had followed their research for probably 10 years. And the first thing I did when I got to London was send them an email, ask if I could be an intern. And I got there and I was fangirling all over their work the whole time. I think my main advice would be to take advantage of the campus, the city, the networks, and fully engage. I also think LSHTM is a collaborative environment. That's what I really loved about it. And I still till today am in touch with my entire cohort where we have a group chat and we share our learnings from our work. And I just feel very proud to even know them and be associated with them.